many parts, including the nose and nasal cavity, the mouth, the pharynx, the larynx, also known as the voice box,
the trachea, the bronchi and bronchioles, which are the air passages into the lungs and kind of look like this, alveoli, which are air sacs of the lungs, which are the most well-known of the system,
and the diaphragm, which is the large muscle that sits under the lungs and controls how they expand. These organs all work together to play an important role in the body, which Jazine and Andrea can tell you about.
The human respiratory system is a combination of the previously said organs that are responsible for taking in oxygen and expelling carbon dioxide from our body.
The oxygen that we breathe in is used in a process called cellular respiration, which gives us the energy we need to live. Sadly, this process creates CO2 as a waste product, so our body has to be able to exhale it to get rid of it. However, without it, we will die.
Oh my God! Okay, it's happening. Everybody stay calm.
Getting rid of excess carbon dioxide and providing ourselves with oxygen is extremely important for us to live, so we need to keep our respiratory system healthy enough to do this for us.
So some common ways to keep your respiratory system healthy are by exercising regularly and by getting enough rest.
Avoiding harmful environmental factors such as smoke, dust, and chemicals.
You can also try introducing more plants into your life and into your home. And practicing some good hygiene as well to reduce your chances of getting sick.
There are some things you can do to avoid an unhealthy respiratory system, but sometimes there are things that cause the system to be unhealthy that are a bit harder to control.
Things like stress, smoking, diseases and disorders, allergies, chemicals, and trauma can all cause the respiratory system to be unhealthy.
They can cause the failure of the respiratory system since they all affect the action of delivering oxygen throughout the body.
Some common types of disorders of the respiratory system are lung cancer and asthma, but there can also be rare diseases like primary ciliary dyskinesia and pertussis.
Lung cancer is the uncontrolled growth of abnormal cells in one or both of your lungs. This is normally caused by normal aging process or through environmental factors. Some symptoms include coughing, chest pain, wheezing, and weight loss, which are more apparent when the cancer is more prevalent. Treatment plans are usually based on the type of lung cancer, the stage of the cancer, and overall health of the patient. 56% of patients diagnosed with early stage lung cancer live for at least 5 years after diagnosis. To lessen your chances of being diagnosed with lung cancer, live smoke-free.
Asthma is known as an autoimmune disease which causes the airways to become narrow and swell up. For some people, asthma is very minor, however, it can be life-threatening to others. The symptoms that people usually get are coughing, tiredness, short of breath, allergy/cold signs and symptoms, chest tightness or pain, and wheezing. Unfortunately, there isn't a cure for asthma since doctors don't even know the exact cause of it. However, one can treat it by controlling the asthma. The doctors will usually give the patient an inhaler or nebulizer and adjust the doses or the medication here and there since every individual has a different level of asthma.
Primary ciliary dyskinesia is a rare inherited disease. It affects tiny hair-like structures called cilia that are found in many areas of the body, including your airways. This disease causes the patient to have faulty or abnormal cilia that can lead to breathing problems, fertility problems, chronic infections, and more. Some common symptoms are chronic nasal congestion, runny nose with mucus and pus discharge, chronic sinus infections, chronic middle ear infections, hearing loss, and, like I previously stated, fertility problems. There are no treatments for faulty cilia, but instead treatment focuses on the disease's manifestations, so the doctors will try and alleviate the symptoms of PCD.
Laryngitis is the inflammation of the larynx, or better known as the voice box. It is mostly caused by common illness, but different forms have a lot and different causes such as smoking, excessive drinking of alcohol, and overusing the voice box. Sore throat, dryness of throat, headache, fever, and difficulty swallowing of some signs and symptoms that will be common with the infection. Treatment is usually done by guided with self-care, but if the pain becomes worse, the doctor will test to see what caused the inflammation. Some common self-care treatments are resting and drinking plenty of fluids. They may prescribe antibiotics in cases where laryngitis has been caused by bacterial infection and corticosteroids that could help reduce the vocal cord inflammation. Laryngitis affects the patient's lifestyle with changes in sitting, talking, and drinking fluids.
Pertussis is a rare infectious disease caused by bacteria Bordetella pertussis. There are around 10,000 to 40,000 reported cases of pertussis each year. This disease is known to negatively impact the human respiratory system beginning from its initial infection of the upper respiratory tract. Bordetella pertussis releases a toxin which narrows the airways, leading to major difficulty in breathing and coughing fits. The treatment of pertussis mainly relies on the use of antibiotics, which serve to remove the bacteria from the patient's respiratory tract. Approximately 400 per every million live births die of pertussis around the world. Fortunately, this disease may be prevented by a pertussis vaccine and the practice of good hygiene.
The human body is a wonderful vessel which makes life possible through the use of many elaborate organ systems,
Including the respiratory system.
The respiratory system uses a combination of chemical reactions and organs such as the lungs to provide the body with its supply of life-giving oxygen and cellular energy. Without it, we will die.
The entry of oxygen and expulsion of harmful carbon dioxide occurs only with the assistance of the amazing human respiratory system.